As you know, and we've discussed before, for many years you've had heartburn, and we've always wondered what the cause of it is. And on X-ray...
Gastrointestinal endoscopy is one test your doctor may use to help better evaluate the condition of your esophagus, stomach, and duodenum.
The endoscopic examination itself is extremely simple.
This procedure is more precise than a conventional X-ray and involves less risk, discomfort, and inconvenience than surgery.
This takes only 15 to 30 minutes, and then when you wake up, we'll go over the results with you.
The upper gastrointestinal tract, more simply known as the digestive tract, is the route through which food enters your body. The digestive tract consists of the following parts: the esophagus, which serves as a passageway for food; the stomach, where acids and digestive juices begin to break the food down into smaller parts; and the duodenum, the upper part of the small intestine, where juices from the pancreas, liver, and gallbladder complete the digestion process, so the food can be absorbed into your body's system. Common problems with the upper digestive tract may include difficulty in swallowing, abdominal pain, bleeding, ulcers, and tumors. In order to view these organs, your doctor will use a device called an endoscope. The endoscope uses bundles of extremely thin and flexible glass fibers called fiber optics to illuminate the digestive tract. Controls allow the tip of the scope to be turned in any direction to aid in the examination. Through the scope, your doctor is able to see the smallest detail of your esophagus, stomach, and duodenum. With relatively little discomfort and inconvenience, endoscopy will permit a safe, quick, and thorough look at your digestive tract, so possible problems can be identified and diagnosed. The risks involved in endoscopy are extremely slight. The first major risk is perforation, which is very unlikely to happen. Hemorrhage could occur when a very large biopsy is taken, but this also is very unlikely. Because certain drugs will be used during the exam, it's important to tell your doctor of any known allergies or reaction to drugs you might have. In preparation for the endoscopy exam, your doctor will usually recommend that you not eat any food or drink any liquids 8 to 10 hours before the exam. The reason for this preparation is simple. The endoscope cannot see through digesting food, so your doctor will not be able to examine your digestive tract. Also, a full stomach may cause vomiting and complications during the exam. In most instances, the endoscopy exam is given at a hospital. However, some doctors are equipped to give the exam in their offices.
Can we spray the back of your throat, Mr. Lazarus, to get it good and numb? Okay, now let me show you. It is, in fact, a spray, so I'll ask you to hold your breath while I'm spraying. Okay, just
a few minutes before the exam, a numbing solution will be sprayed into your throat.
Okay, breathe.
Its purpose is to help reduce your gag reflex when you swallow the endoscope tube.
Okay, one more shot.
If your doctor advises it, you'll be given a sedative. It will make you feel relaxed and a bit groggy, but in most cases, you'll remain conscious.
Yeah. Mr. Lazarus, just open your mouth for me. That's it. Open up.
When the sedative has taken effect, a block will be placed in your mouth to keep it open. Your doctor will then guide the tip of the endoscope into the back of your throat. Air will be gently passed through the endoscope to your stomach to give your doctor a better view of the area. Your doctor will maneuver the endoscope so that all parts of your upper digestive tract can be examined. The exam usually takes about 10 to 15 minutes. You will feel little, if any, of this movement, and you should have no problem breathing. Your doctor can use the endoscope to retrieve a small tissue sample for later evaluation. This is a painless and safe procedure.
Okay now, Mr. Lazarus. It's all finished now, sir. All right, sir.
After the endoscope is removed, you'll be taken to a recovery area or back to your room to allow time for most of the sedative to wear off. But you'll still feel a bit groggy for the next 8 to 12 hours, so driving yourself home will be unsafe. It's best to make arrangements for someone to take you home. There are some minor side effects which you may experience after the endoscopy exam. These include a mild sore throat, a bloated feeling or cramps caused by air pumped into your digestive tract, and a groggy feeling from the sedative. Normally, all of these side effects disappear within 24 hours. You can begin eating again when numbness leaves your throat and you've swallowed some water. In a few days, your doctor will contact you to discuss the results of the exam.
Mr. Lazarus, I have very good news. Your endoscopic examination showed you have a very small ulcer in your esophagus, which is healing. Great. I want you to stay on the medication.
As a diagnostic tool, endoscopy is a safe and efficient procedure, one in which you should have complete confidence.